Hey everyone, I'm Dr. Tyler J. Tolbert, owner of Smile Now Dental Group. If you're missing a tooth or know you'll need to replace one soon, you've probably come across two main options, a dental bridge or a single tooth implant. And you're probably wondering, which one's better? Which one lasts longer? Which one is more natural? In this video, I'll break it all down for you. We'll compare a tooth implant versus a dental bridge, the pros and cons of each, and how to decide which one is right for your situation. Let's help you make the best decision for your smile and your long-term oral health. Let's start by understanding the difference between these two options. A dental bridge is a prosthetic tooth that's held in place by two teeth next to the gap. To place it, those neighboring teeth are filed down and capped with crowns, which support the artificial tooth in the middle. A tooth implant, on the other hand, replaces that gap with a small titanium post that will go in between those natural teeth. Then, a custom crown is attached to the post, making it a standalone solution, so it doesn't affect the teeth on either side. So when we compare tooth bridge versus implant, we're talking about a more traditional, quicker fix in the case of the bridge versus a more modern, long-term solution in the case of the implant. So let's assess the pros and cons of a dental bridge. Usually these are completed in just 2 to 3 visits. There's no surgery required, and more frequently this will be covered by your insurance. It can be a faster, short-term fix. The cons, however, are that you're requiring the grinding down of healthy teeth next to this gap. It also doesn't prevent any bone loss underneath where that missing tooth is, so that bone will continue to erode underneath that false tooth. This also typically lasts about 7 to 10 years before needing a replacement and continuing to cut those adjacent teeth down even more. So you're having to cut off the bridge and then go in and re-prep those adjacent teeth again, losing even more tooth structure. They can also be harder to clean and increase the risk of decay on the supporting teeth. Now remember, these were healthy to begin with. So bridges can be a good option in certain situations, but they do involve compromising 2 healthy teeth just to replace one. Now let's talk about dental implants, the modern gold standard for replacing missing teeth. The benefits of tooth implants include standalone solution. First of all, you're not impacting those neighboring teeth. Next, it preserves the bone structure by stimulating the jawbone as you're chewing, so it's going to keep that bone there for longer. It's also easier to clean and maintain. You can floss them just like a natural tooth. It's also extremely durable. They can last 15 to 25 years or even more. It looks, feels, and functions a lot more like the real tooth, so when you're chewing, it forces going directly to your bone, and your brain oftentimes doesn't even know the difference. Now, the possible considerations there are, it is a higher upfront cost more often than not than a dental bridge, though in a lot of cases it's pretty similar. It does require a minor procedure. Also, the healing time is a little bit longer, around 2 to 4 months before you get the final crown. But if you're thinking about long-term value, health, and stability, implants can win almost every time. That's why more and more patients are choosing implant alternatives instead of the traditional old-school bridges. At Smile Now Dental Group, we believe in helping patients make informed decisions, not just one-size-fits-all recommendations. That's why we offer free consultations where we will evaluate your oral health and bone structure with 3D imaging, review your options, whether that's going to be a bridge, an implant, or something else. We'll talk through your goals, lifestyle, and your budget, and we'll create a personalized treatment plan just for you. And if you choose a tooth implant, you'll get everything done in-house, from imaging, placement, and all the way to the final crown. You'll work directly with me, Dr. Tolbert, every step of the way, and you'll receive a solution that's custom fit, long-lasting, and built for real life. Here's a quick side-by-side. Dental bridges will typically take 2 to 3 visits, whereas a tooth implant will take about 3 to 5 months, so it does take a little bit longer, but bearing in mind, it's more of a long-term solution. The dental bridge will affect your nearby teeth, so yes, this does require grinding down those adjacent teeth. Whereas with a tooth implant, we're not even going to touch them. With bone preservation, the clear winner here is the tooth implant. As far as cleaning and maintenance is concerned, it can be a little bit tricky getting underneath those bridges. We can't really take them off to get up underneath that, so it can be a common cause for a food trap. Whereas with a tooth implant, that's not really going to happen. You clean them very much like normal teeth. As for the average lifespan, a bridge is usually rated for about 7 to 10 years, while implants can go 15, 25, or even be there for a lifetime. As far as cost, a lot of times they are pretty similar depending on how your insurance interacts with bridges versus implants, but a lot of times, really over time, the cost is much better spent on a dental implant. So if you're asking, down to what you value most, dental bridge versus implant, what's better? If it's speed and simplicity, a dental bridge makes a lot of sense. If you're not concerned about how things are going to go long term, go ahead and do the dental bridge. It does make sense in some cases. But if your concern is longevity, health, and performance, you want to go with the implant. Are you still unsure which one is right for you? Let's just talk it through. Simply click the link in the description to schedule your free consultation at Smile Now Dental Group. We'll review your options side by side and help you make the best decision for your smile, your health, and your future. Thanks for watching, and be sure to like and subscribe for more expert dental insights and answers to your top implant questions. We'll see you next time.